Hi everybody, welcome to week 13. So this week we are talking about engaging in scholarship. And in your book, there is some discussion of Boyer and his model for scholarship. It used to be back when, that nursing scholarship was really only considered pure research, qualitative or quantitative, but pure research. And then I think our view expanded with looking at Boyer so that we see other things as important as research, like teaching, for instance. And so nursing has pretty much adopted Boyer's model for scholarship. With the limited amount that Boyer is discussed in your Halstead text, though, I find that students don't really have a total grasp of differentiating the different types of scholarship. And so I'm attaching an article that gives some very concrete examples of the 4 different types of scholarship. And I think that will help you out a little bit that way. Also, kind of in the scholarship vein, we have talked about how we do a lot of reflecting and evaluating of our practice. And what we find is that nurse educators don't take enough credit for all that they do in that area. For example, action research. So action research isn't quite as formal as a experiment, okay? Action research is kind of in the moment while you're experiencing a problem. So basically, you identify a problem in your practice, you collect baseline data, you do some sort of intervention, you collect post-implementation data, and then you see if that intervention was effective or not in solving your problem. And then hopefully you go on to share that with other people, either through publishing or a poster at a conference or a hospital or corporation newsletter, something like that, that you can share your information with other people. So I've included some articles on those also. I've included one article that talks about action research in academia, and that's where nurse educators were having problems with the writing that their students were producing in a nursing education program and how they tackled that. And then the second article has to do with the clinical setting. Yeah, the problem that they were facing is that nurses were spending a large amount of time off of the unit accompanying patients to radiology, and so how they tackled that. So I think there's some two concrete examples, and hopefully you guys can share with us some of the things that have been going on in your own work setting, maybe regarding these, and eventually you'll be the one conducting them, which will be really cool. All right, so kind of looking at this scholarship piece leads us into the portfolio that's due this week, because there is a section in the portfolio where you have to incorporate Boyer's work in some way. I haven't had a lot of questions asked about the portfolio. Hopefully you guys are well on your way with that assignment, especially because the reference letters are in the assignment and there's quite a bit of writing. And again, it doesn't have to be totally just set up like an APA paper, but you do have to show strong academic writing. So my computer's just running out of battery. Let me plug it in here. There we go. So you do have to show academic writing, accurate grammar, there are references required, that sort of thing. Make sure you're using both the assignment directions and the rubric to guide finishing and wrapping up that project. And I'm really looking forward to seeing them. Some of my students have gone a very straightforward route that looks just like a regular paper. I've had students do PowerPoint presentations with extensive speaking notes attached to them. I've had students attach various pictures and clip art and all sorts of different things. The idea is that this is something to encapsulate your learning and your experience that you could maybe present to an employer. So I'm really looking forward to reading those. I always find those to be quite interesting. And so that is going to be due this week. All right, I think those are the big things going on. I'm looking forward to seeing what you have to say about scholarship in your posts. And if you do have any questions about Boyer or differentiating the different areas of scholarship, please be sure and post those. And I'll see you in the main forum.